Hi everyone, I'm Sir July, and for these slide sets, we will be comparing and contrasting the two general types of data and how they relate to infection. These types of data are signs and symptoms. Let us begin. Objective data, also referred to as signs or overt data, are detectable by an observer or can be measured or tested against an accepted standard. Diba? When you ask, Lord, give me a sign, you are asking for something concrete or observable. Signs can be seen, heard, felt, or smelled, and they are obtained by observation or physical examination, which includes the vital signs, not the vital symptoms. When a laboratory result is reported, it is classified as an objective data. In terms of infectious diseases, the following are the signs of infection. Fever can be detected by measuring the temperature, which is a vital sign. Fever is a prominent sign of infection. Therefore, sources of infection must always be sought in a patient with fever. Take note, though, that there are some patients with infection who may not manifest with fever. These patients include the elderly, newborns, patients with chronic hepatic failure, patients with chronic renal failure, or patients taking glucocorticoids or are being treated with an anticytokine. Other signs of infection that involve the vital signs are tachycardia and tachypnea. Patients with severe infection may also manifest with hypotension. Inspection and palpation can reveal signs of infection such as erythema or enlargement of lymph node respectively. Lab findings indicative of but not always due to infection include elevated WBC and ESR. Take note that these are just some of the signs of infectious diseases. You will encounter more as we discuss specific communicable diseases. Subjective data, also referred to as symptoms or covert data, are apparent only to the person affected and can be described or verified only by that person. Itching, pain, and feelings of worry are examples of subjective data. So when a patient says he or she has chest tightness, you cannot say, ay oo nga po, sumisikip yung dibdib nyo. Similarly, when a patient says, nangangati ako, you cannot say, mukha ka namang hindi nangangati. Remember, your symptoms are verified only by that person. To remember this clearly, just imagine being asked by the patient, what is the difference between a sign and a symptom? And remember saying this, for sign, I, the nurse, can observe. For symptom, you, the patient, can feel. For us Filipinos, since English is not our primary language, we could have sometimes difficulty recalling which one is overt or covert. In this instance, you may just use this mnemonic. Covert data, you cannot see something that is covert. Symptoms of infection may include tenderness, malaise, loss of energy, anorexia, or nausea. Take note though that there may be some objective signs that accompany your symptoms. For instance, in tenderness, a guarding behavior is an objective data that may be also seen. And remember, anorexia or the loss of appetite is a symptom. Do not be judging your patient if he or she is obese and he or she claims that he or she has anorexia. A specific group of signs and symptoms that accompany a particular disease is referred to as a syndrome. Examples of syndrome under infectious disease include your acquired immunodeficiency syndrome or your AIDS and severe acute respiratory syndrome or SARS. So that's it. Let us summarize. Sign is objective while your symptom is subjective. Your sign is overt data while your symptom is covert data. Your sign could be assessed, it could be tested, while for your symptom, it could be verified only by the person. At this point, pause your video, gather your thoughts, and when you are ready, let's have a practice test. Pancytopenia is what type of data? Is it a symptom or is it a sign? You have 5 seconds. Pancytopenia is a decrease in your WBC, RBC, and platelet, which could be verified by a laboratory result. Therefore, this is a sign. Abdominal pain is what type of data? Is it A, symptom? Is it B, sign? You have 5 seconds. Since pain can only be verified by the patient, this is a symptom. Which one incorrectly describes symptom? Is it A, overt, or B, subjective? You have 5 seconds. And the answer is overt. Overt is for signs. Remember, symptoms cannot be seen by the nurse and therefore they are covert. Auscultatory findings are A, symptoms, B, signs. You have 5 seconds. The answer here is B. Remember, auscultatory findings or your physical examination findings are considered as signs. That ends this presentation. Please do not forget to subscribe to my YouTube channel, Memory Aid Nursing. Thank you.